Many older adults walk with their knees slightly bent because they are afraid of that tight, uncomfortable pull right behind the joint when trying to straighten the leg fully. When you avoid straightening your leg all the way, soft tissues at the back of your knee can gradually stiffen and shorten over time. This makes your walking strides shorter and causes you to feel less steady on your feet. Today, Sophia will guide you through a very slow, gentle, and safe routine to help restore that natural leg movement right from your chair. Remember, we are here to wake up the body, not to push through pain. If you feel any sharp pain, sudden dizziness, or shortness of breath, please stop right away, take a deep breath, and rest. Welcome to Dr. Sophia. For today's routine, all you need is a stable, sturdy chair with a flat seat and absolutely no wheels. Let's begin by sitting up nice and tall on the front half of your chair. Keep your back straight, pull your shoulders gently back, and place both feet flat on the floor, about hip-width apart. Let your hands rest comfortably on your thighs. Take a deep breath in through your nose, let it out through your mouth, and let's get your body moving safely. We will begin immediately with our first movement, called sitting leg extensions. The goal here is to gently strengthen the big muscle on the front of your thigh, which works like a natural shock absorber to protect your knee joint and keep you stable when walking. Let's start with your stiff or uncomfortable leg first. Slowly squeeze that front thigh muscle and begin to lift your foot, straightening your leg out in front of you as high as you comfortably can without any sharp pulling. Not swing your leg or use momentum to get it up. Move like you are lifting your leg through thick honey. Now, hold it right there at the top for 5 seconds. Keep your toes pointing up toward the ceiling. Let's count together while keeping your breath steady. 5, 4, 3, 2, 1. Excellent. Now, slowly and gently lower your foot back down to the floor with full control. Do not just let your leg drop. Controlling the way down is just as important as lifting it up. Let's perform our second repetition together. Slowly engage that front thigh muscle. Lift the foot up, straighten the knee smoothly. Remember to keep breathing naturally. Never hold your breath when lifting. Feel that front thigh muscle working tightly. 5, 4, 3, 2, 1. Slowly lower it back down to the ground, feeling the muscle control the weight of your leg. As we continue into our third repetition, let's check your posture. A common mistake is leaning your upper body way back or gripping the side of the chair tightly to force the leg up. If you feel yourself leaning back, you are lifting too high. Keep your spine straight and tall. Lift the leg again, hold it for 5, 4, 3, 2, 1. If lifting's completely straight is too difficult or causes discomfort right now, that is perfectly okay. You can try a modified, easier version. Simply lift your foot just a few inches off the floor, keeping a slight bend in your knee. Even this tiny lift is wonderful because it sends a direct signal to activate that thigh muscle, helping your joint stay stable and reducing the daily pressure on your cartilage. Let's do 2 more repetitions together on this side to finish our first set. Lift smoothly, hold it straight, breathe through your nose, 5, 4, 3, 2, 1, and lower with control. Last one for this side, lift it gently, feel the strength in your leg, hold it for 5, 4, 3, 2, 1, and bring it slowly back to the floor. Take a moment to wiggle your toes and let that leg relax. Let's move straight into our second movement, which is called the terminal knee extension. This specific exercise focuses entirely on the last 20 to 30 degrees of your knee movement. This is the exact zone where many people experience stiffness or stop short because the joint feels tight or lacks control. Taking back control of this final range of motion is incredibly important because it directly improves your ability to straighten your leg fully when you stand up and walk. For this variation, we will use that small low stool or ottoman right in front of your chair. Make sure you are still sitting up nice and tall with your spine long. Now, extend your working leg forward and place your heel comfortably on top of that low stool so your knee is almost straight but not completely locked out yet. It is very important that your heel is supported by the stool rather than placing support under the back of your knee. Keep your foot pointing straight up toward the ceiling, making sure your entire leg does not roll outward or twist inward. Take a deep breath in through your nose. As you exhale, actively squeeze the front thigh muscle of that extended leg. Pull your kneecap up and gently press the back of your knee down toward the stool, trying to straighten your leg completely in a comfortable, pain-free range. Think of this like gently tightening a loose bolt at the very end of a framework. Hold this straight position at the very end for 5 seconds while keeping your breath steady. 5, 4, 3, 2, 1. Now, slowly release the contraction and let the muscle relax entirely. Let's do another repetition together. Slowly engage that front thigh muscle. Press the back of the knee down gently and hold. A very common mistake here is trying to force your knee straight by pushing down on your thigh with your hands, or by aggressively snapping the joint into place. Please never snap, bounce, or force the joint. The downward pressure must come entirely from the contraction of your thigh muscle, not from external force or momentum. If you feel a firm contraction in your lower thigh and a mild, comfortable stretch right behind your knee, your alignment is absolutely perfect. Hold for 3, 2, 1, and slowly release. If you have severe joint wear or are recovering from a recent injury, and find that your knee simply cannot straighten all the way right now, please do not discourage yourself. Simply squeeze your thigh muscle gently within whatever small, safe range you currently have, without pushing into any sharp discomfort. Over time, these small contractions re-educate your nervous system, allowing your leg to absorb shock much better whenever you step off a curb or walk down the hallway. Let's finish one last repetition for this set. Squeeze smoothly, press down into a comfortable straight line. Hold for 5, 4, 3, 2, 1, and slowly let it rest. Now let's keep your foot right where it is, or you can place your heel directly on the floor in front of you if that feels more stable. As we transition smoothly into our third movement, the seated hamstring stretch. This exercise targets the large muscles at the back of your thigh. When these muscles become chronically tight, they act like a tense rope, pulling constantly on the back of your knee and hip, which makes your daily walking steps much shorter and can even pull uncomfortably on your lower back. Slide your buttocks a bit closer to the front edge of your chair, ensuring your opposite foot is planted flat and firmly on the ground to keep your balance perfectly secure. Keep your target leg extended straight out in front of you, with your heel resting down and your toes pointing upward. Place both of your hands flat on the top of your thighs. Now sit up completely tall, lengthen your spine, and take a deep breath in. As you exhale, slowly hinge forward from your hips, sliding your hands gently down your leg toward your ankle. Keep your chest open and your back relatively straight as you lean. Stop the very moment you feel a clear, steady, yet comfortable stretch along the back of your thigh. There is absolutely no need to touch your toes. You're going to hold this gentle stretch for 20 seconds to allow the muscle fibers to relax and lengthen naturally. Keep breathing slowly through your nose. Do not bounce or rock your body back and forth. Just hold still and let the tension dissolve. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly slide your hands back up your leg and return to an upright sitting position. Let's check for a vital safety warning before our next stretch. If you have a history of a herniated disc, severe lower back pain, or sciatica, which is that sharp shooting pain or numbness that travels down your leg, you must be extremely cautious. Never round your lower back or slouch your shoulders forward just to force your hands lower down your leg. Rounding your spine transfers all the structural lower back discs instead of stretching your leg. If you ever feel any tingling, numbness, or electric-like sensations, stop immediately and sit up straight right away. Let's perform one more deep stretch together. Sit tall, breathe in, and hinge slowly from the hips while keeping your back straight. Slide your hands down. Feel that beautiful melting release along the back of the thigh, and hold. Let's breathe through it for another 10 seconds. 5, 4, 3, 2, 1. Slowly slide your hands back up and come all the way up to a neutral upright position. Take a deep breath and let your legs completely relax. Let's bring your foot back underneath you for a moment and take a gentle, relaxing breath. Now that the back of your thighs are feeling a bit warmer and more loose, we are going to move further down the leg to focus directly on your calf muscles and your ankles with our fourth movement, the seated calf stretch. When your calves become chronically tight, they limit how far your ankle joint can bend forward when you walk. If your ankle cannot bend properly, your body is forced to shorten your daily walking steps, or your knee has to work twice as hard to clear the ground, which leads to unnecessary joint strain and a higher risk of losing your balance. For this stretch, let's pick up that long towel or strap that you placed next to your chair earlier. Sit nice and tall, right at the front edge of your seat. Extend your target leg straight out in front of you, resting your heel firmly on the floor while keeping your knee relatively straight, but comfortable. Take your towel, loop it securely around the ball of your foot, right under your toes, and hold one end of the towel in each hand. Take a deep breath in through your nose. As you slowly exhale, use your hands to gently pull the ends of the towel back towards your body, encouraging your toes to point up and back towards you. Stop pulling the towel the very second you feel a steady, clear, yet gentle stretch right in the meat of your calf muscle or down toward your heel. We are going to hold this posture for a full 30 seconds to allow the deep connective tissues to unwind naturally. Keep breathing deeply and evenly through your nose. Do not bounce your foot against the towel or pull so forcefully that your toes begin to cramp or tingle. Just hold a calm, steady tension. If this feels too intense for you, or if you have a history of severe ankle swelling, please use our modified version. Simply remove the towel completely. Let your heel rest on the floor and use your own muscle power to pull your toes up toward you as far as you can without any discomfort. Both versions are highly effective because they restore your ankle's natural flexibility, helping your feet absorb the impact of the ground smoothly. Let's count down the final seconds together. 5, 4, 3, 2, 1. Gently relax your hands, unloop the towel, and slide your foot back into a comfortable position. Now that we have successfully opened up your thigh muscles and your calf muscles, your legs are perfectly prepared for our fifth exercise, which is a vital everyday skill called the sit-to-stand technique. Learning to stand up correctly is one of the best ways to completely shield your knees from daily pressure and pain. Let's organize this movement into a safe framework I call the grounded lever protocol. Let's break down the setup together step by step. First, slide your buttocks all the way forward so you are sitting right at the front edge of your chair. Next, place your feet flat on the floor, slightly wider than hip width apart, and pull them back just a little bit so your heels are positioned slightly behind your knees. Open your knees comfortably so they align directly over your toes. Never let your knees cave inward toward each other as you move, as that creates a destructive twisting force inside the joint. Rest your hands lightly on your thighs or across your chest. Before we lift up, let's perform a quick 3-second interactive check right now. Press both heels firmly into the floor and try to wiggle your toes slightly. If you can feel the solid weight of your body anchoring deeply into your heels, or feet are in the perfect starting position. Now inhale deeply. As you exhale, hinge your upper body slightly forward from your hips, keeping your spine completely long and straight. Press down strongly through your heels, firmly squeeze your buttocks muscles together, and use that powerful hip strength to smoothly drive your body all the way up into a tall standing position. Do not throw your shoulders forward or swing your body forcefully to create momentum. Stand all the way up, lengthen your posture, and take a relaxed breath. To complete the movement safely, we must practice the descent with equal care. Inhale, press your hips backward as if you are reaching for a distant bench behind you. Keep your weight planted firmly in your heels, and slowly lower your buttocks back down to the edge of the chair with absolute control. Avoid dropping heavily onto the seat. Controlling your weight on the way down builds incredible structural support around your lower body. Let's take a brief breath, reset our posture, and get ready for our next set of movements. Now that you are sitting back down comfortably, let's look closer at why this specific movement pattern completely changes the environment inside your knee joints. Many people accidentally rely entirely on their front thigh muscles and push up from their toes when standing up. When you do that, it creates a massive crushing force right under your kneecap, squeezing the delicate cartilage against your thigh bone. That is why you might often feel a sharp pinching ache right at the front of your knee the moment you try to lift your body weight. By consciously shifting your focus to your glutes, the large muscles in your buttocks, you fundamentally alter the physics of how your body moves. Your glutes are designed to handle heavy lifting, and when they turn on, they pull your body up from behind, instantly unweighting the front of the knee. Remember our simple forward guide. Heels, glutes, alignment slow. Every single time you stand up from your dinner table, your couch, or even the toilet today, use this exact pattern. Our body adapts beautifully to whatever you repeat most often. If your knees feel a bit tender, don't force yourself to do extra repetitions right now. Just practicing this correct alignment 3 to 5 times a day is a wonderful, safe way to retrain your nervous system and build long-term joint stability. Protecting your joints is a complete circle. It requires moving correctly from the outside, but it also means nourishing those tissues from the inside. Let's talk about a very simple, everyday dietary habit that can offer excellent support to your recovery routine. You might have some broccoli sitting in your kitchen right now. This common green vegetable contains a highly researched compound called sulforaphane. Think of your joint cartilage like a firm inside a well-oiled machine. Over time, certain enzymes in the body can become overly active and begin to slowly degrade that smooth cushion. Laboratory studies have shown that sulforaphane acts like a natural shield, helping to block those specific destructive enzymes and soothing general joint inflammation. Now, broccoli is not a miracle medicine, and it will not completely reverse severe arthritis or replace your prescribed medical treatments. However, it serves as a wonderful nutrient-dense companion to your physical movements. To get the absolute best health benefits from your broccoli, how you prepare it matters tremendously. Avoid boiling it until it turns mushy and pale green, as excessive heat completely destroys the beneficial sulforaphane. Instead, try steaming it lightly for just 3 to 5 minutes until it is tender but still bright green and slightly crisp. If you have a sensitive stomach or tend to experience gas and bloating, avoid eating it raw, as cooked broccoli is much gentler on an older adult's digestive system. There are a few important safety guidelines to keep in mind regarding your daily meals. Broccoli is naturally rich in vitamin K, which plays a major role in blood clotting. If you are currently taking a prescription blood thinner like warfarin, eating sudden, large amounts of broccoli can change how your medication works. You do not need to avoid broccoli completely, but you must keep your green vegetable intake stable and consistent from day to day, and always discuss your diet with your doctor. Additionally, if you have advanced kidney issues and need to monitor your potassium closely, enjoy broccoli in moderate portions, about half a cup to 1 cup cooked, a few times a week. Let's take a peaceful deep breath together as we prepare to transition to our final safety awareness guidelines for the day. As we sit here together and let our legs rest completely after those wonderful movements, I want to share a few very honest protective warnings that many people are never told in the clinic. When you deal with daily knee discomfort or stiffness, it is incredibly tempting to reach for quick fixes, just so you can keep moving through your day. But some of these common habits can silently cause serious harm to your body over time. Let's talk first about over-the-counter pain medications, specifically a group called NSAIDs, which includes common pills like ibuprofen or naproxen. When your joint aches, taking one of these pills might make the pain fade away temporarily, allowing you to walk or do your chores smoothly. However, it is vital to understand that these medications do not heal your cartilage or repair your joint. They simply block the chemical signals that tell your brain something is hurting. When you use these pain relievers frequently or for many days in a row without a doctor's guidance, they begin to disrupt other essential systems in your body. Inside your stomach, these medications turn off the natural protective signals that maintain your stomach lining. Without that shield, the harsh digestive acids can easily cause painful inflammation, deep ulcers, or serious internal bleeding. An important warning sign to watch out for is developing a dark, tarry black stool, which means your stomach lining is bleeding and requires immediate medical attention. Furthermore, these pills cause the delicate blood vessels inside your kidneys to constrict, severely reducing the vital blood flow that your kidneys need to filter your blood. For an older adult, this sudden drop in circulation can rapidly lead to fluid retention, swelling in your ankles, a dangerous spike in your blood pressure, or even acute kidney failure. Pain medication should only be used as a short-term bridge for 3 to 5 days under medical supervision, never as a daily routine to hide your symptoms. The second major trap I see many older adults fall into is relying heavily on over-the-counter knee braces. When your leg feels weak or unstable, buying a tight, elastic brace and wearing it all day long might give you a temporary sense of security. But this external support comes with a very hidden structural cost. Your body is an incredibly smart, adaptive system that always conserves energy. When you wrap a tight brace around your knee for hours at a time, the brace takes over the physical job of holding your joint stable. Because the brace is doing all the structural work, our brain stops sending strong signals to activate your thigh and hip muscles. Muscles essentially become lazy and stop participating in your movements. Over weeks and months of continuous use, this lack of activation leads directly to muscle wasting, also known as muscle atrophy. Your thigh grows smaller and weaker, which means that the very moment you take the brace off to sleep or shower, your knee joint is actually far more loose, unstable, and vulnerable to injury than it was before. True joint stability must come from the inside out. It comes from the active strength of your muscles, your tendons, and the safe movements we practice today. A knee brace should only be used as a temporary tool when you know you have to walk a long distance or perform a demanding task, and it should always be removed when you are sitting down, resting, or sleeping, so your muscles can breathe and stay active. And never let a piece of fabric replace the natural power of your own body. Let's take a slow, calming breath in through the nose, exhale completely, and let your body absorb these important lessons as we move into our gentle cool down. Let's completely relax your shoulders now. Let them drop down away from your ears. Take a deep, slow breath in through your nose. Hold it for just a brief second and let it out smoothly through your mouth. Let your hands hang completely loose by your sides. Gently wiggle your toes and shake your legs out very softly just to let the blood flow easily through your ankles and calves. You have done a wonderful job today, allowing your body to move safely, mindfully, and with absolute control. Let's take one more slow, deep breath together and exhale all the remaining tension from your joints. 2. Help you easily remember everything we covered today. Let's summarize your simple checklist for tonight and tomorrow morning. First, try to practice your safe sit-to-stand technique every single time you get up from a chair today, always focusing on driving through your heels and squeezing your glutes. Second, dedicate just 5 minutes tomorrow morning, while sitting in your favorite chair to perform 5 gentle repetitions of the leg extensions and hamstring stretches we did together. Avoid any rapid bouncing. Never push your body into sharp pain, and remember to remove your knee brace whenever you are just sitting down and resting. Keep a close eye on how your body feels. If you ever notice an unusual dark color in your stool, a sudden spike in blood pressure, or a sharp increase in joint swelling, please stop all exercises immediately and consult your primary care doctor. Remember, a stiff knee or an aching joint is not an enemy to be feared or hidden away. It is simply a messenger from your body, a direct signal telling you that something in your alignment or posture or your daily movement habits needs a little extra care and proper attention. Do not try to just silence that signal with a quick pill or a tight fabric wrap. Instead, let's continue to work together to manage the true underlying cause by rebuilding your natural movement patterns from the foundation up. Now that we have successfully opened up your range of motion and gently released the tightness in your thighs and calves today, our next crucial step is to build a rock-solid framework of stability around those joints. Tomorrow, in day 3, we are going to focus entirely on the deep core muscles that support your spine and the side hip muscles, known as the gluteus medius. Strengthening this specific hip muscle is the ultimate secret to keeping your pelvis perfectly level, improving your balance, and preventing your knees from caving inward when you walk. Thank you so much for investing this time into your health today. If this routine made your legs feel a bit lighter, please save this video so you can easily practice it again tomorrow morning. Please share your current comfort level or your age in the comments below so we can keep learning together. Stay safe, stay active, and Sophia will see you tomorrow for day 3.